Good morning. Hi, everybody. This is Becky with Rochester Mom, and this morning I'm joined by Dr. Melissa Richards, the chair of the OBGYN department at Olmsted Medical Center. We are really excited this morning to announce a brand new roundtable discussion series that we are hosting, Rochester Mom is hosting with Olmsted Medical Center, called Let's Talk. Let's Talk is all about you, the concerns that you've had around different sorts of gynecological, pregnancy, urogynecology, infertility or fertility. We're going to be talking about questions that women have. If you were able to tune into our previous videos, you saw a lot of the questions that we had talked about that women have been afraid or embarrassed to ask their primary care provider. And this new series is kind of taking it a step further and talking about really common things that women are treated for, or questions that they have surrounding their health in this area around our age. And so this morning, our very first roundtable discussion is about something that many women have been experiencing for the last year. And it has affected so many of you, and it's COVID and pregnancy, or COVID and delivery. Lots of questions still remain. So we are so excited to have Dr. Richards with us this morning. Dr. Richards, let's just kick it off right away. Okay, are you ready? Big question.
I'm ready. Let's do this.
Are pregnant women at higher risk to develop severe COVID-19? It's a big question.
Right. And I just want to take a moment. Thank you so much for letting me do this. This is great. This is what our days are filled with, our questions about how, the pandemic is impacting our patients, our colleagues, everybody. So when we talk to patients about COVID in general, we're learning as every day. What I tell patients is I'm giving you the information with the best evidence that I have today. And tomorrow I might have more evidence, or there might be a pivot in what is out there for advice or recommendations. So initially, when the pandemic came out, we were really kind of had a breath where the outcomes were looking about the same, whether a woman was pregnant or not pregnant. But however, with the more data that we have gained, we have learned that pregnant women are at more risk for having more severe symptoms or course compared to their non-pregnant equal, meaning more likely to be admitted to the hospital or intensive care unit, as well as needing help with breathing. So that sounds scary. That's a little scary.
Yeah.
The reassuring thing with that is remembering that our overall chances of having severe features in the age group of women who typically become pregnant is small. Okay. So even though the numbers are, you're more likely to have severe feature or severe issues, they're not as, the overall numbers are pretty small.
And as scary as this information is, it's much better to know. It's Absolutely. Much better to be aware, and it's much better to prepare yourself. And now, as we say in these talks that we've had, knowledge is power. And Absolutely. We want to ensure that readers who are, and viewers who are facing, a pregnancy where COVID is very real still in our world, that they feel equipped. And so this is great information to have. So this leads into, what should pregnant women consider to ensure that they're protecting themselves the best they can from COVID?
Absolutely. Awesome question. I think, we started out kind of with a heavy hitter about.
Yeah, we did.
I know we did. We went up. We
just went for it.
Yeah, we just were like, boom.
Yeah.
The great thing, as someone who has, really I've been around people who have COVID. I've taken care of patients who've had COVID. And it's really, I'm trying to keep myself safe, my colleagues safe, patients safe, and then my family when I go home safe. And so the advice we give pregnant patients is the same as we give non-pregnant patients. Take care of yourself and take care of other people. Wash your hands, wear your mask. Make sure your nose is covered and your mouth is covered, and wash your hands. And if you're doing those things, you're dramatically reducing your risk of getting COVID-19. I've made it through the year personally, wearing my protective gear, washing my hands, and haven't had a high risk exposure that's required me to even be tested for COVID-19. So for me, that's really reassuring.
Amazing.
It is. It also leads into that, and I'm pretty confident we're going to be talking about this too, is like we're putting tools in our toolbox. So our toolbox it was a little sparse. So we had wearing masks, washing our hands, and then doing our social distancing. And now we have another tool that's being put into our toolbox is the vaccination. And the importance of understanding the vaccination and why we're recommending patients receive the vaccination. With the caveat that you need to know and empower yourself with knowledge about the vaccination and why we're recommending it. Yeah.
So as long as we're talking about that, let's just go straight into this. There's been some questions about the COVID vaccine and having a vaccine when you're pregnant. And we'll answer that question first, and then we'll move into the subsequent question that will follow.
Sounds perfect. I do want to give a big shout out to Dr. Gilman in our department. One of our obstetrician gynecologists has an amazing COVID vaccination video on our YouTube page where she gets into the nitty gritty, and it's so good. Like
we'll link that. We can
fantastic.
Link that. Yeah.
Perfect.
Okay.
It's so, she just does a fantastic job. So the COVID vaccination in general, I think it's really important to understand. It's not new technology, the vaccine itself. It's a new virus that we've attached to this vaccination. On the flip side, COVID-19, this variant of the SARS virus, we're not as familiar with at all. We're learning, as I said, day to day. So we have this opportunity to get this vaccine that we know helps prevent hospitalizations and death from a virus that we don't really understand. So we feel really comfortable telling women who are trying to become pregnant, who are pregnant or breastfeeding, that the vaccination is fine to receive the vaccination if you're being offered the vaccination. One thing to keep in mind, especially right now, if you're being offered the vaccination, you're probably one of our frontline people who has a higher risk of being exposed to COVID-19.
Right.
And knowing the risk that can come from being infected. So I feel very comfortable. The American College of OBGYNs, the Society for Maternal Fetal Medicine, the CDC, we all feel comfortable telling patients, if you have the opportunity to get the vaccination, please get the vaccination. We also really appreciate a patient who says, you know what, I don't really feel comfortable getting the vaccination. In that case, I just really encourage them to be around those who maybe have made that choice to get the vaccination. And then, you know, you already have, as I said, you've got those tools in your toolbox. Then I want you, please wear your mask, please wash your hands, and please practice social distancing. And we'll see that. I give myself as an example. For the life of me, I just cannot get immunized against rubella. Like I get the booster shot and I get tested to see if I've developed immunity to it. And my body doesn't create a response. So I'm counting on everyone around me to keep me safe from getting rubella, because I don't create a response to
interesting.
So, I know, isn't it? Right? Just taking care of each other.
Yeah. And I think that this is really helpful because there's so much information out there, and we can read so much credible information regarding the vaccine and all of these things, but it is really helpful and reassuring to hear from a physician who has done with their colleagues due diligence. Yes. Due diligence to ensure that you're not suggesting things that will harm.
Absolutely.
And so you had touched on this really briefly, but can we just circle back to the COVID vaccine and breastfeeding? I
Mhm.
know that this is, I've seen women who, this is not me at this point, but
Mhm.
I've seen women and friends who have, group threads or discussions, and they say, what are you thinking? Should we? Shouldn't we? If you could speak to that just a little bit about the COVID-19 vaccine, and if it affects breastfeeding.
That's a great question. So, in general, just even taking a step back, let's say you do have COVID-19. We
Mm-hmm.
are still encouraging moms who test positive for COVID-19 to breastfeed their
Mm-hmm.
children or
Right.
child. I think that's really important to note. Following, if you're actively in that infectious period, wear your mask, wash your
Mm-hmm.
hands when you're breastfeeding.
Mm-hmm.
But with the vaccination, once again, we feel really comfortable with getting the vaccination and continuing to breastfeed.
Mm-hmm.
This is one of those things where we're going to continue to get more information
Mm-hmm.
and build our knowledge base and
Mm-hmm.
build research about making it, I don't want to say a stronger argument, but
Mm-hmm.
with more information. And then I'd also really strongly encourage, when we have these questions, these oftentimes, I think this is great what we're doing right now, but also just a one-on-one with clinician,
Mm-hmm.
one of our a lactation consultant, someone who you can like look them in the
Mm-hmm.
eyeballs and
Mm-hmm.
talk through why we're still recommending your pediatrician
Yep.
to get the vaccination. Because I think in this moment I can say it's fine, but
Mm-hmm.
this might be one where we really want to talk to maybe not Facebook
Mm-hmm.
experts, but our
Yes.
medical clinician, because we're still learning. The advice we're giving
Yeah.
today might be a little bit different
Mm-hmm.
tomorrow. Mm-hmm.
The main message is to seek out your primary care physician
Mm-hmm.
and have that conversation. Feel empowered and confident to ask these questions.
Yes.
To ensure that you feel prepared.
Yep.
And knowledgeable.
Absolutely.
Yep, that's great. So we've talked about, a little bit about the vaccine. But one question that kind of came up was, can pregnant women infect the baby in the womb with COVID-19 if the mother were to contract COVID-19?
Right. So we do know that can happen.
Okay.
We don't really understand how it happens
Mm-hmm.
because we have patients who get COVID be right before they become pregnant,
Mm-hmm.
first trimester, second trimester, around the time
Mm-hmm.
of delivery.
Mm-hmm.
We know that many of those patients, babies, don't develop COVID-19.
Mm-hmm.
And then there are cases where that is passed on to a baby, and I'm guessing a year and a half from now, or even 2 years from now, we're going to be able to give a much more succinct, like, this is how it happened,
Right.
and this is how we know
Mm-hmm.
it happened. Even the recommendations of how we've been taking care of moms who are infected with COVID-19 in their pregnancy has changed.
Mm-hmm.
We previously were having just about 100% of our patients meet with our high-risk perinatologist or our
Mm-hmm.
high-risk OB doc to go through some recommendations. We were doing some different testing, and
Mm-hmm.
now we're not doing that as much because we're
Mm-hmm.
getting more information, thinking that we're not seeing that. We were nervous it would
Yeah.
be a larger impact with babies, but we're not seeing that right now.
Okay.
Mm-hmm.
So that kind of goes into, should all pregnant women be tested for COVID?
Great question. So in general, we should be following whatever the CDC
Mhm.
recommendations that are out there.
Yeah.
We are testing at our facility, which is really similar to other facilities, all of our patients between 38 and 39 weeks
Mhm.
for COVID-19, as well as we're testing patients that we know are going to have a cesarean section that's scheduled within 5 days of surgery.
Okay.
And, we're doing that for a number of reasons. We're doing that from a patient standpoint. Patients
Mhm.
that test positive, we're want to keep a little bit more of a close eye on those patients. Many of our patients, these are asymptomatic people who maybe haven't been tested, and perhaps we know that you can have a positive COVID-19 test for 90 days or so. So this allows us an opportunity to talk to those patients, what symptoms to watch out for. As well as when you're in the hospital, we're taking some extra precautions and steps to keep their neighbors safe up on the birth center, as well as our staff safe.
Sure.
Yeah. But still, I mean, I was just going to say the part with that is when someone tests positive, I would say the vast majority of those patients who are testing positive, well, now what, right? What does that mean for the delivery and whatnot? And I'm proud where we are right now that I think we're providing still a wonderful experience. They're still having their support person come in, still the importance of, the golden hour and, but still following, the recommendations to keep everyone safe.
So this is a great question that leads right into our next question. So what can someone expect when they are ready to head to the birth center to give birth to their baby? What does it look like?
Right.
Just give a little bit of an understanding or explanation of what women can expect when they step foot onto the birth center floor.
Right. So it's been an interesting year because it's evolved. Like how stepping onto the birth center in March and then like June, August, and even I would say, today is going to be different than a month from now with some of what we're doing. So as of right now, one thing that everyone notices is everyone's wearing a mask, but we're kind of all used to that, right? We see people wearing masks all the time. Wearing eyewear to keep our eyeballs safe. And then the idea right as of today, whatever today is, as of this moment, as we speak,
March
1st, we currently have a one visitor policy with, there are some exceptions where it's the same support person. When you come onto the birth center, that support person can come and go. We have the expectation that when you're around staff, you'll wear your mask. If we're not in your room, you don't need to wear that mask. You should expect when you're in the room, a lot of talking. And I think we're getting better we show a lot of our communication through our body language. And I think what we're all getting so much better at using different cues to show, we care, we're concerned, asking like, does that make sense? What to expect. Otherwise, I think what I love is we want this to be this is such a milestone moment. And I have 2 kiddos at home, and, I've had a baby twice, but I've not had a baby during a pandemic. And, I now have colleagues and physician colleagues, and I have our nursing staff who are having babies right now during this pandemic. And it's been such an experience, and understanding that little things that we took for granted pre-pandemic are more important now. Also just the importance of what to expect today. So communication, like that is something that I have learned so much with our patients, and the importance of them knowing like what we have and where to look for updates. The importance, even prior, we didn't tell patients we appreciate a phone call before you come in, but now we're like, call, please call, please call before you come in, because we want to make sure that that there aren't any surprises.
Sure. Yeah. So it's just, I think that the most reassuring thing is that OMC is putting a priority on the safety of the patient, but also understanding that this is such a special moment that moms have been anticipating and waiting for, and respecting just just what happens when a baby is born. And you, like you mentioned, the golden hour. And I think about facial expressions and how important. And if you've been watching my videos, I talk with my hands, I use my face in a lot of different ways. And if I wasn't able to do that, there's a lot that you have to learn in order to, because you can smile and your eyes don't change. Right. So you're like, I'm really smiling. So there's a lot that you probably have to convey to patients for them to understand that you're truly caring about them at this juncture.
Yeah, I would argue my eyebrows and my eyeballs like are making a lot of like facial expressions, and my hands also.
Right. Yeah,
you're doing so great. This is amazing.
Right.
Yes, absolutely.
So what resources are available for moms who are anticipating a pregnant or giving birth during the pandemic? What resources does OMC have available?
Right. That's a great question. So everyone's a little bit different as they're navigating through the pandemic with their OB care. And it's interesting because we have like first time moms, and then we have, moms who've had a couple babies or a previous delivery with us. So trying to figure out what works for her. So we're trying to minimize exposures to the possibility of COVID, but we're also respecting that sometimes we need that face-to-face in the same room together and more than another patient. So we are doing, when a patient calls to say, hey, I'm pregnant, we're like, that's fantastic. That's great. Go through a couple questions. And then we are setting up a nurse only telephone call. That's an appointment, and go through some of the stuff that we normally would have gone through in the clinic. And then do a bit of education. And then we still are doing appropriate ultrasounds if the patient needs an ultrasound for one reason or another. And then the new OB visit with the clinician, whether it's one of our nurse practitioners or physicians or midwives, that could be a little bit more focused because we now have that information as opposed to getting on the same day of the visit. So then we can do a lot of the counseling that sometimes doesn't get as focused on because we're gathering information previously. So then that's usually around like 10 weeks. And then we get into our 14 to 16 week visit that, depending on the patient, if that patient's low risk and feels comfortable, we're actually doing that visit as a telephone visit or a telehealth.
Oh, okay.
I know, isn't that neat? So we're doing that, like that visit, the 24-week visit, and like the 32-week visit. Some patients just won't qualify for that. We want them to come in if we're worried about blood pressures or blood sugars. So some patients are like, that's amazing. And that's something we're keeping in the back of our mind when this pandemic ends. Like there are going to be patients who will want to continue with that. It makes sense for them to do their visit like that. And then there are patients who are like, I need to see
someone,
a person.
Face to face.
Exactly. Totally. And that's awesome. I also think it's really neat. We've done, because we're not doing our group classes for childbirth or prenatal classes. We're doing a lot more, I think, one-on-ones with our prenatal educator. And then one thing that's awesome is we now have been able to get this really fantastic app called Yomingo, which provides just awesome prenatal education, documentation. It's a great app, and it's free, and it doesn't have a bunch of commercials or ads built into it.
Wow, that's really cool. That's really exciting.
Isn't it? It's good. It's good. It's weird because as much as I'm like frustrated with this pandemic and so over this pandemic, there, as we've all learned, there are some great things that have also kind of came of it.
It's forced us to, in some ways, it's really forced us to execute the ideas that we've always said. Well, what if?
Boom.
What if? What would it ever look like if we did tele appointments?
Right.
And you've never had, it's never been a necessity to experiment. And now, it forced us into the ideas that we've always wondered, what if, and some of them are great and we want to keep going with them. Yeah.
Absolutely.
So it's really interesting and neat to see it, in this area, in the area of pregnancy and childbirth. So, we want to talk about now what happens when the baby is here. What can a mother expect postpartum? I'm thinking, do they come in for their, is it 3-day or 5-day checkup? Do we keep the appointments at those regular intervals, given all the restrictions and, being careful with everything? So I'd like to hear about that.
Absolutely. So, yes, we want to make sure, this has been the flip side of the pandemic with healthcare, is people haven't been coming in because we're scared, right? We don't know, or the barriers or obstacles to get in for these appointments. But it's very important for all of those, well baby visits right after the baby's born. Please come in. Please come to those visits. They're important. Our lactation department, our peds, our family medicine, we're taking all of these precautions to keep mom, baby safe, everybody safe, dads, moms, everybody. So it's vital because, to be more proactive as opposed to reactive. Those weight checks are really important.
Right.
Yeah. And if another really important thing, if in the back of your mind, you're really nervous or freaking out about these visits, like verbally say them, like whether it's the front desk person, whether it's to the nurse, whoever, they'll help you kind of walk through what to expect. Right. Absolutely.
Right. So I think that it's really important to acknowledge that what we're talking about today was not within anyone's realm of understanding or acknowledgement 13 months ago, 14 months ago. We were not thinking about this. There was no preparedness plan. There was nothing, there was just no information. And so I just want to take a moment to say, this is heavy stuff. And for some women, it might be okay. Rolling with the punches, great support system. But if it's not, if this is really stressful for you, we just want to encourage you to speak that to your primary care. Please, if you don't have anyone in your life, speak this to your primary care physician. They can chat with you. If you find yourself, with increased anxiety or these sorts of things, there are resources at OMC that are able to help you, manage what you're feeling and what you're experiencing. And not only your primary care, but the great psychology and psychiatry department at OMC too can help if you feel like you need even further help. So I know that you were going to mention that too, so I just kind of jumped in.
That was good. That was good.
Too. But just to acknowledge to all of you that are reading or that are watching today that there are others who are experiencing exactly what you're experiencing. And OMC is there for you. Dr. Richards and her team is there for you. She mentioned this great video by Dr. Gilman that will post about the COVID-19 vaccine and pregnancy. But then I also wanted to share too with you, Dr. Richards, just some of the things that women have been saying, that we just want to normalize what's been happening with different women in the community. So something that's interesting that somebody said was their 11-month-old screams if anyone except them takes their mask off. So they've been conditioned to understand that masks are normal. When we know that that's not exactly right, but this is a short 11-month life. And so some people said that, pregnancy's been okay, but it's been lonely with a baby. Sad that the kids, won't be able to meet in the hospital, meet the baby, but that they've been managing the expectations going into that. And so just, you've seen all of these experiences. So if you could just, to wrap up our conversation, just, what would you say to a mom who's expecting or who is preparing to give birth? What would you just say to someone who's just wondering what on earth is going to happen here?
Right. You kind of caught me off guard. I got a little teary-eyed here on this. It's good. No, it's good. I am every day blown away by the resilience of these people. Like, we didn't know a year ago where we'd be sitting today, and just the trust to be given. Oh my gosh, the resilience. And we can talk as much as we talk here in the clinic visits, but to go home and things, baby showers, grandpas and grandmas coming in, all of these like milestones that I took for granted in my pregnancy. It's been different, and still, like, it's just been so impressive. Like, I just am blown away. And as you said, Becky, I see women who are like, yeah, well, here we are. And then you see that struggle and celebrating those moments. And, they haven't all been great. We're talking a lot about pregnancy, but there's been loss, right? And going through that loss, and, it's just, it's so much. And then we just keep doing it. And then, as I said, just celebrating these good moments and these moments to connect. And I've said this since the beginning, I'm just so humbled to be a part of something, people's lives, and to have that opportunity. And I know I speak for the entire staff here that we're just so grateful to be able to do what we do every day, even during a pandemic.
That's really poignant. And I think to end, just to clearly verbalize that we're talking about is not normal, right? We're just not in a normal chunk of history. And so I just really wanted to pick up on what you said about resiliency, because the women that are going through pregnancy and childbirth right now are resilient and mind-blowing, and the strength that they're showcasing to not only others but themselves as well is just needs to be acknowledged. So we're now acknowledging it today, that your resilience and strength is just really
awe-inspiring,
truly. But then also just to know that the OMC providers are doing everything that they can to ensure that you feel empowered still, and you feel knowledgeable during this experience. So, Dr. Richards, thank you for joining us for our first Let's Talk Roundtable. Learned a lot. Hopefully our readers have too. Our viewers, if you have any questions regarding anything, please feel free to put them in the comments below or send an email, info@rochestermom.com. We'll make sure that these questions get to Dr. Richards. We can answer them in a subsequent roundtable talk. So we will be having a couple more of these coming up. We're going to be talking about general gynecological and pelvic health. We're also going to be talking about fertility related issues in kind of those middle to late 30s, when some women are choosing to have their children. So stay tuned for these really great discussions. And again, thank you so much for joining us, Dr. Richards.
Thank you.
All right.